BPSC BPS 17, Medical Officer and Lady Medical Officer. Paper 10. 100 most repeated questions taken from authentic past papers. Put your headphones on for better focus. After each question you get 5 seconds, pause if you need to. Let us begin. Question 1. Hodgkin lymphoma is distinguished from non-Hodgkin lymphoma by the presence of Option A. Leukemic phase. Option B. Bone marrow involvement. Option C. Extranodal spread. Option D. B symptoms. The correct answer is option D. B symptoms. Let's go through the options. Leukemic phase. A leukemic phase is more typical of some non-Hodgkin lymphomas. Bone marrow involvement. Marrow involvement occurs in both types. Extranodal spread. Extranodal spread is commoner in non-Hodgkin lymphoma. And the correct answer is B symptoms. Correct. Reed-Sternberg cells and prominent B symptoms characterize Hodgkin lymphoma. Defining feature is the Reed-Sternberg cell. So, the right answer is option D. B symptoms. Question 2. Staging of Hodgkin lymphoma is done by Option A. Bone marrow biopsy alone. Option B. Chest X-ray alone. Option C. CT scan. Option D. Lymph node biopsy alone. The correct answer is option C. CT scan. Let's go through the options. Bone marrow biopsy alone. Marrow biopsy alone does not stage it. Chest X-ray alone. A chest X-ray alone is insufficient. Lymph node biopsy alone. A node biopsy diagnosis but does not stage. And the correct answer is CT scan. Correct. CT scanning, chest, abdomen, pelvis, is used to stage Hodgkin lymphoma. So, the right answer is option C. CT scan. Question 3. In infectious mononucleosis, which is not expected? Option A. Splenomegaly. Option B. Sore throat. Option C. Lymphadenopathy. Option D. Absence of fever. The correct answer is option D. Absence of fever. Let's go through the options. Splenomegaly. Splenomegaly is expected in mononucleosis. Sore throat. Sore throat is expected. Lymphadenopathy. Lymphadenopathy is expected. And the correct answer is absence of fever. Correct. Fever is usually present, so absence of fever is not expected. So, the right answer is option D. Absence of fever. Question 4. Acanthosis nigricans is caused by all of the following except Option A. Obesity. Option B. Internal malignancy. Option C. Insulin resistance. Option D. Starvation. The correct answer is option D. Starvation. Let's go through the options. Obesity. Obesity causes acanthosis nigricans. Internal malignancy. Internal malignancy causes it. Insulin resistance. Insulin resistance causes it. And the correct answer is starvation. Correct. Starvation does not cause acanthosis nigricans. So, the right answer is option D. Starvation. Question 5. Nelson syndrome follows which procedure? Option A. Hypophysectomy. Option B. Bilateral adrenalectomy. Option C. Thyroidectomy. Option D. Splenectomy. The correct answer is option B, bilateral adrenalectomy. Let's go through the options. Hypophysectomy. Hypophysectomy does not cause Nelson syndrome. Thyroidectomy. Thyroidectomy is unrelated. Splenectomy. Splenectomy is unrelated. And the correct answer is bilateral adrenalectomy. Correct. Nelson syndrome follows bilateral adrenalectomy, a rapidly growing pituitary corticotroph tumor. So, the right answer is option B. Bilateral adrenalectomy. Question 6. Radioiodine therapy for thyrotoxicosis most often results in option A, thyroid carcinoma. Option B, hypothyroidism. Option C, persistent hyperthyroidism. Option D, thyroiditis. The correct answer is option B, hypothyroidism. Let's go through the options. Thyroid carcinoma. Thyroid carcinoma is not the usual outcome. Persistent hyperthyroidism. Persistent hyperthyroidism can occur, but hypothyroidism is the usual result. Thyroiditis. Thyroiditis is not the main long-term result. And the correct answer is hypothyroidism. Correct. Radioiodine commonly causes hypothyroidism. So, the right answer is option B. Hypothyroidism. Question 7. Thyrotoxic eye disease includes all of the following except option A, proptosis. Option B, lid lag. Option C, ptosis. Option D, lid retraction. The correct answer is option C, ptosis. Let's go through the options. Proptosis. Proptosis occurs in thyroid eye disease. Lid lag. Lid lag occurs. Lid retraction. Lid retraction occurs. And the correct answer is ptosis. Correct. Ptosis is not a feature. Thyroid eye disease causes lid retraction. So, the right answer is option C. Ptosis. Question 8. In diabetic ketoacidosis, the breath smells of option A, rotten apples. Option B, fish. Option C, ammonia. Option D, garlic. The correct answer is option A, rotten apples. Let's go through the options. Fish. A fishy odor suggests other causes. Ammonia. An ammoniacal odor suggests uremia. Garlic. A garlic odor suggests organophosphate arsenic. And the correct answer is rotten apples. Correct. The Ka gives a sweet rotten apple acetone breath. So, the right answer is option A. Rotten apples. Question 9. Plummer-Vinson syndrome is most common in option A, females. Option B, males. Option C, children. Option D, neonates. The correct answer is option A, females. Let's go through the options. Males. It is not male predominant. Children. It is not a childhood disease. Neonates. It is not a neonatal condition. And the correct answer is females. Correct. Plummer-Vinson syndrome is commonest in middle-aged women. So, the right answer is option A. Females. Question 10. Histotoxic hypoxia is characterized by option A, anemia. Option B, low cardiac output. Option C, low inspired oxygen. Option D, normal oxygen delivery with failure of tissue utilization. The correct answer is option D, normal oxygen delivery with failure of tissue utilization. Let's go through the options. Anemia. Anemic hypoxia is due to low hemoglobin, not tissue failure. Low cardiac output. Low cardiac output is stagnant hypoxia. Low inspired oxygen. Low inspired oxygen is hypoxic hypoxia. And the correct answer is normal oxygen delivery with failure of tissue utilization. Correct histotoxic hypoxia is failure of tissue oxygen utilization, e.g. cyanide, despite normal delivery. So, the right answer is option D. Normal oxygen delivery with failure of tissue utilization. Question 11. Bagasosis results from exposure to option A, cotton dust. Option B, coal dust. Option C, moldy sugar cane. Option D, silica. The correct answer is option C, moldy sugar cane. Let's go through the options. Cotton dust. Cotton dust causes biocinosis. Coal dust. Coal dust causes pneumoconiosis. Silica. Silica causes silicosis. And the correct answer is moldy sugar cane. Correct bagasosis results from moldy sugar cane, bagasse, dust. So, the right answer is option C. Moldy sugar cane. Question 12. Which is not one of the major Jones criteria for rheumatic fever? Option A, erythema marginatum. Option B, raised ASO titer. Option C, chorea. Option D, carditis. The correct answer is option B, raised ASO titer. Let's go through the options. Erythema marginatum. Erythema marginatum is a major Jones criterion. Chorea. Chorea is a major criterion. Carditis. Carditis is a major criterion. And the correct answer is raised ASO titer. Correct, a raised ASO titer is minor evidence of streptococcal infection, not a major criterion. So, the right answer is option B. Raised ASO titer. Question 13. Mitral stenosis murmur characteristically. Option A, radiates to the carotids. Option B, does not radiate to the axilla. Option C, radiates to the axilla. Option D, radiates to the back. The correct answer is option B. Does not radiate to the axilla. Let's go through the options. Radiates to the carotids. Mitral stenosis does not radiate to the carotids. Radiates to the axilla. Radiation to the axilla is mitral regurgitation. Radiates to the back. It does not radiate to the back. And the correct answer is does not radiate to the axilla. Correct, the mid-diastolic mitral stenosis murmur is localized and does not radiate to the axilla. So, the right answer is option B. Does not radiate to the axilla. Question 14. Response to hepatitis C therapy is monitored by option A, serum ALT. Option B, liver biopsy. Option C, PCR RNA viral load. Option D, genotype only. The correct answer is option C, PCR RNA viral load. Let's go through the options. Serum ALT. ALT reflects inflammation, not viral clearance. Liver biopsy. Biopsy assesses damage, not treatment response. Genotype only. Genotype guides therapy but does not monitor response. And the correct answer is PCR RNA viral load. Correct HCV treatment response is monitored by PCR RNA viral load. So, the right answer is option C. PCR RNA viral load. Question 15. Which is not a hepatitis B viral marker? Option A, BEAG. Option B, HBsAg. Option C, anti-HBC. Option D, anti-HBE as a marker of active replication. The correct answer is option D, anti-HBE as a marker of active replication. Let's go through the options. BEAG. BEAG is a hepatitis B marker. HBsAg. HBsAg is a marker. Anti-HBC. Anti-HBC is a marker. And the correct answer is anti-HBE as a marker of active replication. Correct anti-HBE indicates low replication, so calling it a marker of active replication is wrong. So, the right answer is option D. Anti-HBE as a marker of active replication. Question 16. Deranged liver function tests may result from excess of Option A, vitamin K. Option B, vitamin C. Option C, vitamin A. Option D, vitamin B12. The correct answer is option C, vitamin A. Let's go through the options. Vitamin K. Vitamin K excess does not typically derange LFTs. Vitamin C. Vitamin C excess does not derange LFTs. Vitamin B12. Vitamin B12 excess does not derange LFTs. And the correct answer is vitamin A. Correct hypervitaminosis is hepatotoxic and deranges LFTs. So, the right answer is option C. Vitamin A. Question 17. Malnutrition of the marasmic type is characterized by Option A, oedema without wasting. Option B, severe wasting without oedema. Option C, normal weight. Option D, hepatomegaly. The correct answer is option B, severe wasting without oedema. Let's go through the options. Oedema without wasting. Oedema without wasting is kwashiorkor. Normal weight. Normal weight excludes marasmus. Hepatomegaly. Hepatomegaly is a kwashiorkor feature. And the correct answer is severe wasting without oedema. Correct marasmus is severe wasting without oedema. So, the right answer is option B. Severe wasting without oedema. Question 18. Staphylococci are characterized as Option A, catalase negative. Option B, coagulase negative. Option C, both negative. Option D, coagulase positive and catalase positive. The correct answer is option D, coagulase positive and catalase positive. Let's go through the options. Catalase negative. Staphylococci are catalase positive. Coagulase negative. S. aureus is coagulase positive. Both negative. Both negative is wrong. And the correct answer is coagulase positive and catalase positive. Correct, Staphylococcus aureus is coagulase positive and catalase positive. So, the right answer is option D. Coagulase positive and catalase positive. Question 19. Sleep apnea in an obese young child most often results in Option A, asthma. Option B, pulmonary hypertension and cor pulmonale. Option C, bronchiectasis. Option D, pneumothorax. The correct answer is option B, pulmonary hypertension and cor pulmonale. Let's go through the options. Asthma. Sleep apnea does not primarily cause asthma. Bronchiectasis. It does not cause bronchiectasis. Pneumothorax. It does not cause pneumothorax. And the correct answer is pulmonary hypertension and cor pulmonale. Correct. Chronic hypoxia from obstructive sleep apnea causes pulmonary hypertension and cor pulmonale. So, the right answer is option B. Pulmonary hypertension and cor pulmonale. Question 20. Rickets is characterized on X-ray by option A, decreased bone density. Option B, increased bone density. Option C, normal density. Option D, sclerosis. The correct answer is option A, decreased bone density. Let's go through the options. Increased bone density. Increased density is osteopetrosis. Normal density. Density is not normal. Sclerosis. Sclerosis is not a rickets feature. And the correct answer is decreased bone density. Correct. Rickets shows decreased bone density with cupping fraying of metaphyses. So, the right answer is option A. Decreased bone density. Question 21. In the operative management of missile injuries, the principle is to option A, incise the deep fascia widely. Option B, close the wound primarily. Option C, avoid debridement. Option D, apply a tight dressing. The correct answer is option A, incise the deep fascia widely. Let's go through the options. Close the wound primarily. Primary closure risks gas gangrene. Avoid debridement. Debridement is essential. Apply a tight dressing. A tight dressing risks compartment syndrome. And the correct answer is incise the deep fascia widely. Correct. Missile, gunshot, wounds are managed by wide incision of the deep fascia and debridement, leaving the wound open. So, the right answer is option A. Incise the deep fascia widely. Question 22. A bony fragment in a compound fracture should not be removed instead. Option A, traction is applied. Option B, the fragment is discarded. Option C, the wound is closed tightly. Option D, a drain is placed. The correct answer is option D. A drain is placed. Let's go through the options. Traction is applied. Traction alone does not address the fragment. The fragment is discarded. A viable bony fragment should not be discarded. The wound is closed tightly. Tight closure risks infection. And the correct answer is a drain is placed. Correct. Retain the fragment and place a drain. Do not discard viable bone. So, the right answer is option D. A drain is placed. Question 23. Sutures give the best cosmetic result when removed within. Option A, 10 days. Option B, 3 weeks. Option C, 24 hours. Option D, 6 weeks. The correct answer is option A, 10 days. Let's go through the options. 3 weeks. 3 weeks leaves suture marks. 24 hours. 24 hours is too early for wound strength. 6 weeks. 6 weeks is far too long. And the correct answer is 10 days. Correct. Removing sutures within about 10 days gives the best cosmetic result, facial sutures sooner. So, the right answer is option A. 10 days. Question 24. When suturing the face, wound margins should be option A. Overlapped. Option B. Inverted. Option C. Everted. Option D. Left open. The correct answer is option C. Everted. Let's go through the options. Overlapped. Overlapping margins heal poorly. Inverted. Inverted margins heal poorly. Left open. Leaving open is not primary facial repair. And the correct answer is everted. Correct. Facial wound margins should be everted for a fine scar. So, the right answer is option C. Everted. Question 25. Which suture material is non-absorbable? Option A. Polypropylene. Option B. Polyglactin. Option C. Catet. Option D. Polydioxino. The correct answer is option A. Polypropylene. Let's go through the options. Polyglactin. Polyglactin, Vicryl, is absorbable. Catet. Catet is absorbable. Polydioxino. Polydioxino, PDS, is absorbable. And the correct answer is polypropylene. Correct. Polypropylene, Prolene, is a non-absorbable suture. So, the right answer is option A. Polypropylene. Question 26. Catgut is traditionally stored in option A. Isopropyl alcohol. Option B. Water. Option C. Formalin. Option D. Normal saline. The correct answer is option A. Isopropyl alcohol. Let's go through the options. Water. Not stored in water. Formalin. Not stored in formalin. Normal saline. Not stored in saline. And the correct answer is isopropyl alcohol. Correct. Catgut is traditionally stored in isopropyl alcohol. So, the right answer is option A. Isopropyl alcohol. Question 27. Dacron vascular grafts are made of option A. Bovine pericardium. Option B. Silicone. Option C. Synthetic textile. Option D. Human vein. The correct answer is option C. Synthetic textile. Let's go through the options. Bovine pericardium. Dacron is not bovine pericardium. Silicone. It is not silicone. Human vein. They are not human vein. And the correct answer is synthetic textile. Correct. Dacron grafts are a synthetic textile, polyester. So, the right answer is option C. Synthetic textile. Question 28. Varicose veins are best treated surgically by option A. Stripping alone. Option B. Division and ligation at sites of incompetent perforators. Option C. Sclerotherapy alone. Option D. Compression alone. The correct answer is option B. Division and ligation at sites of incompetent perforators. Let's go through the options. Stripping alone. Stripping alone misses perforators. Sclerotherapy alone. Sclerotherapy alone is for smaller veins. Compression alone. Compression alone is conservative, not surgical. And the correct answer is division and ligation at sites of incompetent perforators. Correct. Varicose veins are treated by division ligation at incompetent perforators with stripping. So, the right answer is option B. Division and ligation at sites of incompetent perforators. Question 29. Injection sclerotherapy of varicose veins uses. Option A. Normal saline. Option B. Ethanolamine oleate. Option C. Heparin. Option D. Adrenaline. The correct answer is option B. Ethanolamine oleate. Let's go through the options. Normal saline. Saline is not a sclerosant here. Heparin. Heparin is an anticoagulant. Adrenaline. Adrenaline is not a sclerosant. And the correct answer is ethanolamine oleate. Correct. Ethanolamine oleate is a sclerosant for varicose veins. So, the right answer is option B. Ethanolamine oleate. Question 30. Orthosystemic shunt surgery cannot be performed if the patient is. Option A. Diabetic. Option B. Hypertensive. Option C. Jaundiced. Option D. Anemic. The correct answer is option C. Jaundiced. Let's go through the options. Diabetic. Diabetes does not preclude shunt surgery. Hypertensive. Hypertension does not preclude it. Anemic. Anemia is correctable, not an absolute bar. And the correct answer is jaundiced. Correct. Significant jaundice, poor liver function, contraindicates portosystemic shunt surgery. So, the right answer is option C. Jaundiced. Question 31. Instrument used to harvest a skin graft is the. Option A. Bone saw. Option B. Humby knife. Option C. Scalpel. Option D. Curette. The correct answer is option B. Humby knife. Let's go through the options. Bone saw. A bone saw is not for skin grafts. Scalpel. A scalpel is not the standard graft knife. Curette. A curette is not used. And the correct answer is Humby knife. Correct. A Humby knife harvests split skin grafts. So, the right answer is option B. Humby knife. Question 32. Trauma in its early stage is characterized metabolically by. Option A. No change. Option B. Anabolism. Option C. Ketosis only. Option D. Catabolism. The correct answer is option D. Catabolism. Let's go through the options. No change. There is a metabolic change after trauma. Anabolism. Early trauma is catabolic, not anabolic. Ketosis only. Ketosis alone does not describe it. And the correct answer is catabolism. Correct. The early ebb flow response to trauma is catabolic. So, the right answer is option D. Catabolism. Question 33. The commonest endogenous cause of Cushing syndrome is. Option A. Ectopic ACTH. Option B. Adrenal carcinoma. Option C. Pituitary adenoma. Option D. Adrenal hyperplasia. The correct answer is option C. Pituitary adenoma. Let's go through the options. Ectopic ACTH. Ectopic ACT is a less common endogenous cause. Adrenal carcinoma. Adrenal carcinoma is uncommon. Adrenal hyperplasia. Adrenal hyperplasia is usually secondary to ACT excess. And the correct answer is pituitary adenoma. Correct. A pituitary adenoma, Cushing disease, is the commonest endogenous cause. So, the right answer is option C. Pituitary adenoma. Question 34. Hirsutism, acne, and weight gain in a young female are investigated with option A. Serum calcium. Option B. Liver function tests. Option C. FSH, LH and testosterone. Option D. Urea and electrolytes. The correct answer is option C. FSH, LH and testosterone. Let's go through the options. Serum calcium. Serum calcium is irrelevant to hirsutism. Liver function tests. LFTs are not the workup. Urea and electrolytes. Urea and electrolytes are not the workup. And the correct answer is FSH, LH and testosterone. Correct. Hirsutism acne is investigated with FSH, LH and testosterone, PCOS workup. So, the right answer is option C. FSH, LH and testosterone. Question 35. A prominent ischial spine on pelvic examination indicates which pelvis? Option A. Gynaecoid. Option B. Anthropoid. Option C. Android. Option D. Platyploid. The correct answer is option C. Android. Let's go through the options. Gynaecoid. The gynaecoid pelvis has blunt spines. Anthropoid. The anthropoid pelvis is oval. Platyploid. The platyploid pelvis is flat. And the correct answer is android. Correct. Prominent ischial spines indicate an android pelvis. So, the right answer is option C. Android. Question 36. The corpus luteum, after regression and fibrosis, becomes the option A. Theca luteus cyst. Option B. Corpus albicans. Option C. Graafian follicle. Option D. Corpus luteum of pregnancy. The correct answer is option B. Corpus albicans. Let's go through the options. Theca luteus cyst. A theca luteus cyst is HCG driven, not the regressed corpus luteum. Graafian follicle. The Graafian follicle precedes ovulation. Corpus luteum of pregnancy. The corpus luteum of pregnancy persists, it does not regress. And the correct answer is corpus albicans. Correct. The regressed, fibrosed corpus luteum becomes the corpus albicans. So, the right answer is option B. Corpus albicans. Question 37. Coitus in adolescence is a risk factor for carcinoma of the cervix. Which statement is incorrect? Option A. It increases exposure to HPV. Option B. It reduces the risk. Option C. It is associated with multiple partners. Option D. It is a recognized risk factor. The correct answer is option B. It reduces the risk. Let's go through the options. It increases exposure to HPV. Early coitus increases HPV exposure, true statement. It is associated with multiple partners. Multiple partners is a true risk association. It is a recognized risk factor. It is a recognized risk factor, true. And the correct answer is it reduces the risk. Correct. The incorrect statement is that it reduces risk, Early coitus increases cervical cancer risk. So, the right answer is option B. It reduces the risk. Question 38. A woman on oral contraceptives for 6 years with a liver mass is investigated by option A. Observation. Option B. Ultrasound alone. Option C. Liver function tests alone. Option D. CT-guided biopsy. The correct answer is option D. CT-guided biopsy. Let's go through the options. Observation. Observation ignores a possible adenoma. Ultrasound alone. Ultrasound alone is insufficient. Liver function tests alone. LFTs alone do not characterize the mass. And the correct answer is CT-guided biopsy. Correct. A liver mass on long-term OCPS, hepatic adenoma, is investigated by imaging with CT-guided biopsy. So, the right answer is option D. CT-guided biopsy. Question 39. Krickenberg tumor of the ovary is a metastasis from the option A. Colon. Option B. Lung. Option C. Stomach. Option D. Breast. The correct answer is option C. Stomach. Let's go through the options. Colon. The colon is a less classic Krickenberg source. Lung. The lung is not the source. Breast. The breast is a less classic source. And the correct answer is stomach. Correct. A Krickenberg tumor is a signet ring metastasis, classically from the stomach. So, the right answer is option C. Stomach. Question 40. The length of the female urethra is approximately option A. 4 cm. Option B. 2 cm. Option C. 8 cm. Option D. 12 cm. The correct answer is option A. 4 cm. Let's go through the options. 2 cm. 2 cm is too short. 8 cm. 8 cm is the male urethra range. 12 cm. 12 cm is far too long. And the correct answer is 4 cm. Correct. The female urethra is about 4 cm long. So, the right answer is option A. 4 cm. Question 41. Postmenopausal fractures occur at all of the following sites except the option A. Vertebra. Option B. Hip in the earliest phase. Option C. Distal radius. Option D. Neck of femur later. The correct answer is option B. Hip in the earliest phase. Let's go through the options. Vertebra. Vertebral fractures occur post-menopause. Distal radius. Distal radius, calls, fractures occur. Neck of femur later. Femoral neck fractures occur later. And the correct answer is hip in the earliest phase. Correct. The hip fractures later, not in the earliest phase. So hip in the earliest phase is the exception. So, the right answer is option B. Hip in the earliest phase. Question 42. Puerperal pyrexia is defined as a temperature above 38 degrees on any two of the first. Option A. 10 days after delivery. Option B. 2 days. Option C. 20 days. Option D. 30 days. The correct answer is option A. 10 days after delivery. Let's go through the options. 2 days. 2 days is not the definition. 20 days. 20 days is too long. 30 days. 30 days is too long. And the correct answer is 10 days after delivery. Correct. Puerperal pyrexia is a temperature 38 degrees Celsius on any two of the first 10 days after delivery. So, the right answer is option A. 10 days after delivery. Question 43. Stress incontinence in a multiparous woman is due to option A. Fistula. Option B. Pelvic floor weakness. Option C. Detrusor instability. Option D. Infection. The correct answer is option B. Pelvic floor weakness. Let's go through the options. Fistula. A fistula causes continuous, not stress, incontinence. Detrusor instability. Detrusor instability causes urge incontinence. Infection. Infection causes urgency dysuria, not stress incontinence. And the correct answer is pelvic floor weakness. Correct. Stress incontinence in a multiparous woman is due to pelvic floor weakness. So, the right answer is option B. Pelvic floor weakness. Question 44. Earliest secondary hormonal development at puberty depends on option A. Pituitary maturation. Option B. Adrenal maturation. Option C. Gondal failure. Option D. Thyroid maturation. The correct answer is option A. Pituitary maturation. Let's go through the options. Adrenal maturation. Adrenal maturation, adrenarche, contributes but the driver is pituitary. Gondal failure. Gondal failure would prevent puberty. Thyroid maturation. Thyroid maturation is not the trigger. And the correct answer is pituitary maturation. Correct. Puberty begins with maturation of the hypothalamic pituitary axis. So, the right answer is option A. Pituitary maturation. Question 45. A 7-month-old child is typically able to option A. Speak sentences. Option B. Run. Option C. Walk alone. Option D. Say tata and wave bye-bye. The correct answer is option D. Say tata and wave bye-bye. Let's go through the options. Speak sentences. Speaking sentences is far beyond 7 months. Run. Running is a toddler skill. Walk alone. Walking alone is till the 12 months. And the correct answer is say tata and wave bye-bye. Correct. A 7-month-old can wave bye-bye and say tata, babble gesture. So, the right answer is option D. Say tata and wave bye-bye. Question 46. Night terrors in a young child characteristically occur during option A. Sleep onset only. Option B. REM sleep. Option C. Wakefulness. Option D. Non-REM deep sleep. The correct answer is option D. Non-REM deep sleep. Let's go through the options. Sleep onset only. Night terrors are not at sleep onset. REM sleep. They are not in REM sleep. Wakefulness. They do not occur in wakefulness. And the correct answer is non-REM deep sleep. Correct. Night terrors occur in non-REM deep, slow wave sleep. So, the right answer is option D. Non-REM deep sleep. Question 47. A child with microcytic anemia and a habit of eating chalk has option A. Sideroblastic anemia. Option B. Lead poisoning only. Option C. Pica from iron deficiency. Option D. Thalassemia. The correct answer is option C. Pica from iron deficiency. Let's go through the options. Sideroblastic anemia. Sideroblastic anemia does not classically cause pica. Lead poisoning only. Lead poisoning is a differential but pica is classically iron deficiency. Thalassemia. Thalassemia does not cause pica. And the correct answer is pica from iron deficiency. Correct. Pica, eating chalk, with microcytic anemia indicates iron deficiency. So, the right answer is option C. Pica from iron deficiency. Question 48. A child with abdominal pain and jaundice whose father had a splenectomy at 25 is investigated by Option A. CT abdomen. Option B. Bone marrow biopsy. Option C. Liver biopsy. Option D. Osmotic fragility test. The correct answer is option D. Osmotic fragility test. Let's go through the options. CT abdomen. CT is not the first test for a hereditary hemolytic history. Bone marrow biopsy. Marrow biopsy is not first line. Liver biopsy. Liver biopsy is not indicated. And the correct answer is osmotic fragility test. Correct. A family history of splenectomy with hemolysis suggests hereditary spherocytosis. Test osmotic fragility. So, the right answer is option D. Osmotic fragility test. Question 49. Learning difficulty with impaired social interaction and repetitive behavior suggests. Option A. Deafness. Option B. Autism. Option C. Cerebral palsy. Option D. Epilepsy. The correct answer is option B. Autism. Let's go through the options. Deafness. Deafness does not give repetitive behavior. Cerebral palsy. Cerebral palsy is a motor disorder. Epilepsy. Epilepsy is not this picture. And the correct answer is autism. Correct. Impaired social interaction with repetitive behavior indicates autism. So, the right answer is option B. Autism. Question 50. Tetralogy of Fallot accounts for what proportion of congenital heart disease? Option A. 10 to 15%. Option B. 1%. Option C. 30%. Option D. 50%. The correct answer is option A. 10 to 15%. Let's go through the options. 1%. 1% is too low. 30%. 30% is too high. 50%. 50% is far too high. And the correct answer is 10 to 15%. Correct. Tetralogy of Fallot accounts for about 10% of congenital heart disease. So, the right answer is option A. 10 to 15%. Question 51. In croup, the treatment widely used but of no proven benefit is Option A. Oxygen. Option B. Nebulized adrenaline. Option C. Dexamethasone. Option D. Moist steam inhalation. The correct answer is option D. Moist steam inhalation. Let's go through the options. Oxygen. Oxygen is beneficial in croup. Nebulized adrenaline. Nebulized adrenaline helps acutely. Dexamethasone. Dexamethasone is proven to help. And the correct answer is moist steam inhalation. Correct. Moist steam inhalation is widely used but has no proven benefit. So, the right answer is option D. Moist steam inhalation. Question 52. Chonal atresia presents with option A. Hoarseness, option B. Rhinolalia clausa and cyclical cyanosis, option C. Dysphagia, option D. stridor. The correct answer is option B. Rhinolalia clausa and cyclical cyanosis. Let's go through the options. Hoarseness. Hoarseness is not the chonal atresia sign. Dysphagia. Dysphagia is not the feature. Stridor. Stridor is not the classic sign. And the correct answer is Rhinolalia clausa and cyclical cyanosis. Correct. Bilateral chonal atresia gives Rhinolalia clausa and cyclical cyanosis, relieved by crying. So, the right answer is option B. Rhinolalia clausa and cyclical cyanosis. Question 53. In the human, the haploid male gamete contains option A. 22 autosomes and a Y chromosome, option B. 23 autosomes, option C. 44 autosomes, option D. 22 autosomes only. The correct answer is option A. 22 autosomes and a Y chromosome. Let's go through the options. 23 autosomes. 23 autosomes is wrong. There are 22 autosomes plus 1 sex chromosome. 44 autosomes. 44 autosomes is the diploid number. 22 autosomes only. 22 autosomes only omits the sex chromosome. And the correct answer is 22 autosomes and a Y chromosome. Correct. The haploid sperm carries 22 autosomes plus a Y or kiss smiley chromosome. So, the right answer is option A. 22 autosomes and a Y chromosome. Question 54. Cortical mastoidectomy is indicated in option A. Otitis externa, option B. Otosclerosis, option C. Acute mastoiditis, option D. Wax impaction. The correct answer is option C. Acute mastoiditis. Let's go through the options. Otitis externa. Otitis externa does not need mastoidectomy. Otosclerosis. Otosclerosis is treated by stapedectomy. Wax impaction. Wax impaction does not need surgery. And the correct answer is acute mastoiditis. Correct. Cortical, simple mastoidectomy is indicated for acute mastoiditis. So, the right answer is option C. Acute mastoiditis. Question 55. Lateral sinus thrombosis is confirmed by option A. Weber test, option B. Rinner test, option C. Tobier test, option D. caloric test. The correct answer is option C. Tobier test. Let's go through the options. Weber test. The Weber test is for hearing lateralization. Rinner test. The Rinner test compares air-bone conduction. Caloric test. The caloric test assesses vestibular function. And the correct answer is Tobier test. Correct. The Tobier test confirms lateral sinus thrombosis. So, the right answer is option C. Tobier test. Question 56. A perforation of the pars flaccida is termed option A. Marginal perforation, Option B. Central perforation. Option C. Attic perforation. Option D. Subtotal perforation. The correct answer is option C. Attic perforation. Let's go through the options. Marginal perforation. A marginal perforation involves the annulus. Central perforation. A central perforation is in the pars tensa. Subtotal perforation. A subtotal perforation is large in the pars tensa. And the correct answer is attic perforation. Correct. A pars flaccida perforation is an attic perforation. So, the right answer is option C. Attic perforation. Question 57. Battle sign refers to option A. Otorrhea. Option B. Periorbital bruising. Option C. Nasal bleeding. Option D. Ecchymosis over the mastoid. The correct answer is option D. Ecchymosis over the mastoid. Let's go through the options. Otorrhea. Otorrhea is CSF ear discharge, not the battle sign. Periorbital bruising. Periorbital bruising is raccoon eyes. Nasal bleeding. Nasal bleeding is not the battle sign. And the correct answer is ecchymosis over the mastoid. Correct battle sign is ecchymosis over the mastoid, base of skull fracture. So, the right answer is option D. Ecchymosis over the mastoid. Question 58. Caldwell-Look operation is performed for intractable purulent. Option A. Frontal sinusitis. Option B. Maxillary sinusitis. Option C. Ethmoiditis. Option D. Rhinitis. The correct answer is option B. Maxillary sinusitis. Let's go through the options. Frontal sinusitis. Caldwell-Look is not for frontal sinusitis. Ethmoiditis. It is not for ethmoiditis. Rhinitis. It is not for rhinitis. And the correct answer is maxillary sinusitis. Correct. The Caldwell-Look operation drains chronic maxillary sinusitis. So, the right answer is option B. Maxillary sinusitis. Question 59. Sudden increase in size of a multinodular goiter with hoarseness suggests. Option A. Thyroiditis. Option B. Simple colloid change. Option C. Follicular or anaplastic carcinoma. Option D. Cyst formation. The correct answer is option C. Follicular or anaplastic carcinoma. Let's go through the options. Thyroiditis. Thyroiditis does not usually cause rapid growth with hoarseness. Simple colloid change. Simple colloid change is slow and painless. Cyst formation. A cyst does not cause hoarseness. And the correct answer is follicular or anaplastic carcinoma. Correct. Rapid goiter enlargement with hoarseness, recurrent laryngeal involvement suggests follicular anaplastic carcinoma. So, the right answer is option C. Follicular or anaplastic carcinoma. Question 60. Symptoms of hypopharyngeal disease include. Option A. Hoarseness only. Option B. Sore throat and a neck lump. Option C. Epistaxis. Option D. Facial pain. The correct answer is option B. Sore throat and a neck lump. Let's go through the options. Hoarseness only. Hoarseness alone is laryngeal. Epistaxis. Epistaxis is nasal. Facial pain. Facial pain is not hypopharyngeal. And the correct answer is sore throat and a neck lump. Correct. Hypopharyngeal disease presents with sore throat and a neck lump, nodal spread. So, the right answer is option B. Sore throat and a neck lump. Question 61. The facial nerve during parotid surgery is best preserved by option A. Using a nerve stimulator alone. Option B. Beginning distally at the branches. Option C. Blunt dissection only. Option D. Identifying the proximal trunk first. The correct answer is option D. Identifying the proximal trunk first. Let's go through the options. Using a nerve stimulator alone. A stimulator alone is not the primary method. Beginning distally at the branches. Starting distally is riskier. Blunt dissection only. Blunt dissection alone is not reliable. And the correct answer is identifying the proximal trunk first. Correct. The facial nerve is preserved by first identifying its main trunk proximally. So, the right answer is option D. Identifying the proximal trunk first. Question 62. Xylocaine 2% is used for infiltration in option A. General anesthesia. Option B. Septoplasty. Option C. Spinal anesthesia. Option D. Epidural block. The correct answer is option B. Septoplasty. Let's go through the options. General anesthesia. Xylocaine infiltration is not general anesthesia. Spinal anesthesia. It is not for spinal anesthesia, different preparation. Epidural block. It is not an epidural agent here. And the correct answer is septoplasty. Correct. 2% lidocaine, xylocaine, is infiltrated for local procedures such as septoplasty. So, the right answer is option B. Septoplasty. Question 63. In a road traffic accident victim with previous opioid abuse, the best analgesic is option A. Oral ibuprofen. Option B. Oral paracetamol. Option C. Intravenous morphine or methadone. Option D. No analgesia. The correct answer is option C. Intravenous morphine or methadone. Let's go through the options. Oral ibuprofen. Oral ibuprofen is inadequate for major trauma pain. Oral paracetamol. Paracetamol alone is inadequate. No analgesia. Withholding analgesia is inhumane and wrong. And the correct answer is intravenous morphine or methadone. Correct. Severe trauma pain in an opioid-tolerant patient needs for morphine or methadone, adequate dosing. So, the right answer is option C. Intravenous morphine or methadone. Question 64. Parkinsonism is a recognized complication of all except option A. Metoclopramide. Option B. Levodopa. Option C. Methyldopa. Option D. Chlorpromazine. The correct answer is option B. Levodopa. Let's go through the options. Metoclopramide. Metoclopramide causes drug-induced Parkinsonism. Methyldopa. Methyldopa can cause Parkinsonism. Chlorpromazine. Chlorpromazine causes Parkinsonism. And the correct answer is levodopa. Correct. Levodopa treats Parkinsonism, so it is the exception. So, the right answer is option B. Levodopa. Question 65. Osteoporosis is a recognized side effect of Option A. Ranitidine. Option B. Metformin. Option C. Amlodipine. Option D. Dexamethasone. The correct answer is option D. Dexamethasone. Let's go through the options. Ranitidine. Ranitidine does not cause osteoporosis. Metformin. Metformin does not cause osteoporosis. Amlodipine. Amlodipine does not cause osteoporosis. And the correct answer is dexamethasone. Correct. Long-term corticosteroids, dexamethasone, cause osteoporosis. So, the right answer is option D. Dexamethasone. Question 66. Trigeminal neuralgia is treated with Option A. Paracetamol. Option B. Carbamazepine, baclofen or gabapentin. Option C. Morphine. Option D. Aspirin. The correct answer is option B. Carbamazepine, baclofen or gabapentin. Let's go through the options. Paracetamol. Paracetamol does not control neuralgic pain. Morphine. Morphine is not first line for neuralgia. Aspirin. Aspirin is ineffective. And the correct answer is carbamazepine, baclofen or gabapentin. Correct. Trigeminal neuralgia is treated with carbamazepine or baclofen gabapentin. So, the right answer is option B. Carbamazepine, baclofen or gabapentin. Question 67. Cefotaxime is ineffective against Option A. Streptococcus. Option B. Bacteroides fragilis. Option C. Klebsiella. Option D. Escherichia coli. The correct answer is option B. Bacteroides fragilis. Let's go through the options. Streptococcus. Cefotaxime covers streptococci. Klebsiella. It covers Klebsiella. Escherichia coli. It covers E. coli. And the correct answer is Bacteroides fragilis. Correct. Cefotaxime is ineffective against Bacteroides fragilis anaerobe. So, the right answer is option B. Bacteroides fragilis. Question 68. Which muscle relaxant has the longest duration of action? Option A. Doxycurium. Option B. Atracurium. Option C. Mivacurium. Option D. Suxamethonium. The correct answer is option A. Doxycurium. Let's go through the options. Atracurium. Atracurium is intermediate. Mivacurium. Mivacurium is short. Suxamethonium. Suxamethonium is ultra-short. And the correct answer is Doxycurium. Correct. Doxycurium is the longest-acting non-depolarizing relaxant. So, the right answer is option A. Doxycurium. Question 69. Insects in the external auditory canal are killed before removal using Option A. Chloroform or oil instillation. Option B. Suction alone. Option C. Syringing alone. Option D. Forceps alone. The correct answer is option A. Chloroform or oil instillation. Let's go through the options. Suction alone. Suction alone may not kill it. Syringing alone. Syringing alone can drive it in. Forceps alone. Forceps alone may cause injury while it is alive. And the correct answer is chloroform or oil instillation. Correct. Instill oil chloroform to kill an oral insect before removal. So, The right answer is option A. Chloroform or oil installation. Question 70. Antituberculous therapy causing optic neuritis is chiefly option A. Streptomycin, option B. Rifampicin, option C. Pyrazinamide, option D. Ethambutol. The correct answer is option D. Ethambutol. Let's go through the options. Streptomycin. Streptomycin is ototoxic, not optic. Rifampicin. Rifampicin causes orange secretions hepatitis. Pyrazinamide. Pyrazinamide causes hyperuricemia. And the correct answer is ethambutol. Correct, ethambutol causes optic neuritis, color vision acuity loss. So, the right answer is option D. Ethambutol. Question 71. Lithotripsy is appropriate for renal stones measuring. Option A. Less than 2 centimeters. Option B. More than 3 centimeters. Option C. Any size. Option D. Staghorn only. The correct answer is option A. Less than 2 centimeters. Let's go through the options. More than 3 centimeters. Stones over 3 centimeters need other approaches. Any size. Not any size. Staghorn only. Staghorn stones are not ideal for ESWL alone. And the correct answer is less than 2 centimeters. Correct, ESWL, lithotripsy, suits renal stones under tilde 2 cm. So, the right answer is option A. Less than 2 centimeters. Question 72. Blood in the anterior chamber is termed. Option A. Subconjunctival hemorrhage. Option B. Hypopyon. Option C. Vitreous hemorrhage. Option D. Hyphema. The correct answer is option D. Hyphema. Let's go through the options. Subconjunctival hemorrhage. Subconjunctival hemorrhage is on the eye surface. Hypopyon. Hypopyon is pus, not blood, in the anterior chamber. Vitreous hemorrhage. Vitreous hemorrhage is behind the lens. And the correct answer is hyphema. Correct, blood in the anterior chamber is a hyphema. So, the right answer is option D. Hyphema. Question 73. Deuteranopia refers to blindness for which color? Option A. Red. Option B. Yellow. Option C. Blue. Option D. Green. The correct answer is option D. Green. Let's go through the options. Red. Red blindness is protanopia. Yellow. Yellow is not deuteranopia. Blue. Blue blindness is tritanopia. And the correct answer is green. Correct, deuteranopia is green color blindness. So, the right answer is option D. Green. Question 74. Overactivity of the inferior oblique muscle produces. Option A. Enophthalmos. Option B. Ptosis. Option C. Entropion. Option D. Ectropion of the eye position. The correct answer is option D. Ectropion of the eye position. Let's go through the options. Enophthalmos. Enophthalmos is not caused by inferior oblique overaction. Ptosis. Ptosis is unrelated. Entropion. Entropion is a lid problem. And the correct answer is ectropion of the eye position. Correct. Inferior oblique overaction elevates the adducted eye, upward-outward deviation. So, the right answer is option D. Ectropion of the eye position. Question 75. Cicatricial entropion is treated by option A. Observation. Option B. Eversion of the lid with tarsal surgery. Option C. Antibiotic drops. Option D. Patching. The correct answer is option B. Eversion of the lid with tarsal surgery. Let's go through the options. Observation. Observation does not correct cicatricial entropion. Antibiotic drops. Antibiotic drops do not correct the lid. Patching. Patching does not correct it. And the correct answer is eversion of the lid with tarsal surgery. Correct. Cicatricial entropion is treated by lid eversion with tarsal, scar-correcting surgery. So, the right answer is option B. Eversion of the lid with tarsal surgery. Question 76. The image formed in direct ophthalmoscopy is option A. Erect, virtual and magnified. Option B. Inverted and real. Option C. Erect and magnified. Option D. Inverted and virtual. The correct answer is option A. Erect, virtual and magnified. Let's go through the options. Inverted and real. Inverted real is indirect ophthalmoscopy. Erect and magnified. It is magnified, not magnified. Inverted and virtual. It is virtual but erect, not inverted. And the correct answer is erect, virtual and magnified. Correct. Direct ophthalmoscopy gives an erect, virtual, magnified image. So, the right answer is option A. Erect, virtual and magnified. Question 77. The image formed in indirect ophthalmoscopy is option A. Inverted and virtual. Option B. Erect and virtual. Option C. Erect and real. Option D. Inverted, real and magnified. The correct answer is option D. Inverted, real and magnified. Let's go through the options. Inverted and virtual. It is real, not virtual. Erect and virtual. It is inverted, not erect. Erect and real. It is inverted, not erect. And the correct answer is inverted, real and magnified. Correct. Indirect ophthalmoscopy gives an inverted, real, magnified image. So, the right answer is option D. Inverted, real and magnified. Question 78. Direct ophthalmoscopy magnifies the fundus approximately. Option A. Twice. Option B. 3 times. Option C. 15 times. Option D. 50 times. The correct answer is option C. 15 times. Let's go through the options. Twice. Twice is too low. 3 times. 3 times is too low. 50 times. 50 times is too high. And the correct answer is 15 times. Correct. Direct ophthalmoscopy magnifies about 15 times. So, the right answer is option C. 15 times. Question 79. The muscles controlling the pupil are derived embryologically from option A. Mesoderm. Option B. Endoderm. Option C. Neural crest only. Option D. Ectoderm. The correct answer is option D. Ectoderm. Let's go through the options. Mesoderm. The pupil muscles are not mesodermal. Endoderm. Not endodermal. Neural crest only. Neural crest contributes to some structures, but the sphincter dilator come from neuroectoderm. And the correct answer is ectoderm. Correct. The pupillary, sphincter dilator, muscles derive from ectoderm, neuroectoderm of the optic cup. So, the right answer is option D. Ectoderm. Question 80. Villus adenoma of the large intestine is option A. Never precancerous. Option B. Infective. Option C. Purely inflammatory. Option D. Precancerous. The correct answer is option D. Precancerous. Let's go through the options. Never precancerous. A villus adenoma is not benign, never precancerous. Infective. It is not infective. Purely inflammatory. It is not purely inflammatory. And the correct answer is precancerous. Correct. A villus adenoma of the colon is precancerous, high malignant potential. So, the right answer is option D. Precancerous. Question 81. Glomus tumor characteristically arises in the option A. Palm. Option B. Nail bed. Option C. Sole. Option D. Scalp. The correct answer is option B. Nail bed. Let's go through the options. Palm. The palm is not the classic glomus site. Sole. The sole is not the classic site. Scalp. The scalp is not the classic site. And the correct answer is nail bed. Correct. A glomus tumor classically arises in the nail bed, painful. So, the right answer is option B. Nail bed. Question 82. Nikolsky sign is characteristic of option A. Pemphigus vulgaris. Option B. Psoriasis. Option C. Eczema. Option D. Lichen planus. The correct answer is option A. Pemphigus vulgaris. Let's go through the options. Psoriasis. Psoriasis does not show Nikolsky sign. Eczema. Eczema does not show it. Lichen planus. Lichen planus does not show it. And the correct answer is Pemphigus vulgaris. Correct. Nikolsky sign, skin shearing with pressure, is characteristic of Pemphigus vulgaris. So, the right answer is option A. Pemphigus vulgaris. Question 83. Lupus vulgaris is a form of option A. Sarcoidosis. Option B. Systemic lupus. Option C. Cutaneous tuberculosis. Option D. Fungal infection. The correct answer is option C. Cutaneous tuberculosis. Let's go through the options. Sarcoidosis. Lupus vulgaris is not sarcoidosis. Systemic lupus. It is not systemic lupus. Fungal infection. It is not fungal. And the correct answer is cutaneous tuberculosis. Correct. Lupus vulgaris is a form of cutaneous tuberculosis. So, the right answer is option C. Cutaneous tuberculosis. Question 84. Rhinophyma is a glandular form of option A. Basal cell carcinoma. Option B. Acne vulgaris. Option C. Acne rosacea. Option D. Sarcoidosis. The correct answer is option C, acne rosacea. Let's go through the options. Basal cell carcinoma. Rhinophyma is not basal cell carcinoma. Acne vulgaris. It is not acne vulgaris. Sarcoidosis. It is not sarcoidosis. And the correct answer is acne rosacea. Correct, rhinophyma is a glandular, sebaceous form of acne rosacea. So, the right answer is option C. Acne rosacea. Question 85. Malnutrition in a surgical patient may be assessed by option A, Candida skin testing for allergy. Option B, pulse rate. Option C, blood pressure. Option D, serum sodium. The correct answer is option A, Candida skin testing for allergy. Let's go through the options. Pulse rate. Pulse rate does not assess nutrition. Blood pressure. Blood pressure does not assess nutrition. Serum sodium. Serum sodium does not assess nutrition. And the correct answer is Candida skin testing for allergy. Correct, nutritional, immune status can be assessed by Candida skin allergy testing. So, the right answer is option A. Candida skin testing for allergy. Question 86. Myiasis is infestation with option A, fly larvae. Option B, mosquito larvae. Option C, lice. Option D, ticks. The correct answer is option A, fly larvae. Let's go through the options. Mosquito larvae. It is not mosquito larvae. Lice. It is not lice. Ticks. It is not ticks. And the correct answer is fly larvae. Correct, myiasis is infestation with fly larvae, maggots. So, the right answer is option A. Fly larvae. Question 87. Hydatid disease is acquired from option A, undercooked pork. Option B, dog faces. Option C, contaminated water. Option D, mosquito bite. The correct answer is option B, dog faces. Let's go through the options. Undercooked pork. Undercooked pork transmits tapeworm trichinosis, not hydatid. Contaminated water. Not from contaminated water. Mosquito bite. Not from mosquito bite. And the correct answer is dog faces. Correct, hydatid disease is acquired from dog, canine, faces, echinococcus eggs. So, the right answer is option B. Dog faces. Question 88. Trichinosis is acquired from eating undercooked. Option A, fish. Option B, beef. Option C, pork. Option D, chicken. The correct answer is option C, pork. Let's go through the options. Fish. Fish is not the trichinosis source. Beef. Beef is not the usual source. Chicken. Chicken is not the source. And the correct answer is pork. Correct, trichinosis is acquired from undercooked pork. So, the right answer is option C. Pork. Question 89. Insensible loss increases most with option A, fever and hyperventilation. Option B, cold weather. Option C, bed rest. Option D, sedation. The correct answer is option A, fever and hyperventilation. Let's go through the options. Cold weather. Cold weather reduces it. Bed rest. Bed rest does not increase it. Sedation. Sedation does not increase it. And the correct answer is fever and hyperventilation. Correct. Insensible loss increases most with fever and hyperventilation. So, the right answer is option A. Fever and hyperventilation. Question 90. Vesicular skin lesions are characteristic of option A. Rubella. Option B. Scarlet fever. Option C. Measles. Option D. Chickenpox. The correct answer is option D. Chickenpox. Let's go through the options. Rubella. Rubella gives a maculopular rash. Scarlet fever. Scarlet fever gives a sandpaper rash. Measles. Measles gives a maculopular rash. And the correct answer is chickenpox. Correct. Chickenpox gives vesicular skin lesions. So, the right answer is option D. Chickenpox. Question 91. Scotopic vision is mediated by option A. Bipolar cells. Option B. Cones. Option C. Rods. Option D. Amacrine cells. The correct answer is option C. Rods. Let's go through the options. Bipolar cells. Bipolar cells relay signals, they are not photoreceptors. Cones. Cones mediate photopic, day, vision. Amacrine cells. Amacrine cells modulate signals, not scotopic vision. And the correct answer is rods. Correct. Scotopic, night, vision is mediated by rods. So, the right answer is option C. Rods. Question 92. The spleen contains approximately what proportion of the blood volume? Option A. About 5%. Option B. 20%. Option C. 30%. Option D. 50%. The correct answer is option A. About 5%. Let's go through the options. 20%. 20% is too high. 30%. 30% is too high. 50%. 50% is far too high. And the correct answer is about 5%. Correct. The spleen holds about 5%, a small reservoir of blood volume. So, the right answer is option A. About 5%. Question 93. On examination, the spleen characteristically moves with option A. Respiration. Option B. Pulsation. Option C. Coughing only. Option D. Position change only. The correct answer is option A. Respiration. Let's go through the options. Pulsation. It does not pulsate. Coughing only. It does not move only with coughing. Position change only. It does not move only with position change. And the correct answer is respiration. Correct. The spleen moves with respiration, down on inspiration. So, the right answer is option A. Respiration. Question 94. The stapedial reflex is a favorable prognostic sign in option A. Otosclerosis. Option B. Meniere disease. Option C. Bell palsy. Option D. Presbycusis. The correct answer is option C. Bell palsy. Let's go through the options. Otosclerosis. Otosclerosis is not the context here. Meniere disease. Meniere disease is not assessed by the stapedial reflex prognosis. Presbycusis. Presbycusis is not assessed this way. And the correct answer is Bell palsy. Correct, a preserved stapedial reflex is a favorable prognostic sign in Bell palsy. So, the right answer is option C. Bell palsy. Question 95. The middle cranial fossa transmits which cranial nerves? Option A, 3rd, 4th, 5th and 6th. Option B, 7th and 8th. Option C, 9th to 12th. Option D, 1st and 2nd. The correct answer is option A, 3rd, 4th, 5th and 6th. Let's go through the options. 7th and 8th. 7 and 8 pass through the posterior fossa, internal acoustic meters. 9th to 12th. 9-12 are posterior fossa. 1st and 2nd. I and 2 are anterior optic canal. And the correct answer is 3rd, 4th, 5th and 6th. Correct, the middle cranial fossa transmits cranial nerves 3, 4, V and 6. So, the right answer is option A. 3rd, 4th, 5th and 6th. Question 96. The parotid duct opens opposite which tooth? Option A, upper second molar. Option B, lower first molar. Option C, upper canine. Option D, lower incisor. The correct answer is option A, upper second molar. Let's go through the options. Lower first molar. Not the lower first molar. Upper canine. Not the upper canine. Lower incisor. Not a lower incisor. And the correct answer is upper second molar. Correct, the parotid, Stenson, duct opens opposite the upper second molar. So, the right answer is option A. Upper second molar. Question 97. Bilateral temporal field loss results from a lesion at the Option A, occipital cortex. Option B, optic nerve. Option C, optic tract. Option D, optic chiasma. The correct answer is option D, optic chiasma. Let's go through the options. Occipital cortex. The occipital cortex lesion gives homonymous defects. Optic nerve. An optic nerve lesion gives monocular loss. Optic tract. An optic tract lesion gives homonymous hemianopia. And the correct answer is optic chiasma. Correct, a chiasmal lesion gives bitemporal hemianopia. So, the right answer is option D. Optic chiasma. Question 98. Incisions on the hard palate are made through the Option A, mucosa only. Option B, muscle layer. Option C, periosteum. Option D, submucosa only. The correct answer is option C, periosteum. Let's go through the options. Mucosa only. Mucosa only incisions are too superficial for palate flaps. Muscle layer. The hard palate has little muscle. Submucosa only. Submucosa only is not the plane. And the correct answer is periosteum. Correct, hard palate incisions are made down to the periosteum, mucoperiosteal flap. So, the right answer is option C. Periosteum. Question 99. Increased urinary hydroxyproline indicates turnover of Option A, collagen. Option B, keratin. Option C, elastin. Option D. Actin. The correct answer is option A. Collagen. Let's go through the options. Keratin. Keratin is not measured this way. Elastin. Elastin is not the main source. Actin. Actin is not measured by hydroxyproline. And the correct answer is collagen. Correct urinary hydroxyproline reflects collagen turnover. So, the right answer is option A. Collagen. Question 100. Scurvy is caused by deficiency of option A. Vitamin A, option B. Vitamin C, option C. Vitamin D, option D. Vitamin K. The correct answer is option B. Vitamin C. Let's go through the options. Vitamin A. Vitamin A deficiency causes night blindness. Vitamin D. Vitamin D deficiency causes rickets. Vitamin K. Vitamin K deficiency causes bleeding. And the correct answer is vitamin C. Correct, scurvy is due to vitamin C deficiency. So, the right answer is option B. Vitamin C.